Okay, well, it is 5:01. We're going to start right on time. I hope everyone can hear me. My name is Carmen Tong. I'm the Medical Student Clerkship Director for UAB Urology. And thank you so much to all of you for being here. I see that we have nearly 70 plus folks online. Some of you are varying stages of your medical school career. We've got some medical school faculty on call. And then, of course, a great representation of program leadership on this call to share with you their insights and experiences and advice. And a special thank you to Dr. Martha Terrace, who sort of embarked on this journey with me to try to get this great info out to all of the students. We want to make this process equitable. And Dr. Terrace has been an incredible mentor to get this program started. And so without further ado, we're going to actually jump right into it. I do have a PowerPoint slide. The program is called Student Underrepresented Curriculum within the Southeastern Section, or SUC-SES. I'm not super clever with acronyms, but I did come up with that one and I'm quite proud of it. And so I hope it catches. But essentially, this is going to be all things related to acting internships, the ERAS application process, and of course, the interview process. So we're going to get started. The first 30 minutes, we're going to focus on acting internships. We're going to talk about the hidden curriculum, how to prepare for talks, the do's and don'ts of what to do while you're on your acting internships. And for this portion of the session, we're going to have panelists Dr. Jillian Stearns from Atrium Health Carolinas Medical Center. We've got Dr. Patrick Hensley, who's coming from University of Kentucky, Dr. Borowski from University of North Carolina, Chapel Hill, and Dr. Dave Penson from Vanderbilt University Medical Center. Dr. Stearns, are you on right now?
I'm here.
Okay, great. I will go ahead and advance your slides for you if that's okay. You just let me know when.
Yeah, sure. Sounds good. You can go ahead.
Oh, is it not showing up on your end that I'm advancing slides?
I don't see anything.
Okay. Let me check.
Carmen, your slides never came up.
Oh, my slides never came up. Well, you know what? It would be helpful if I share my screen, wouldn't it? Sorry about that, folks. All right. Take two. How's that?
It's thinking about it. Oh, there.
It was thinking. Okay.
There we go.
Perfect.
So like Dr. Tong said, I am Dr. Stearns, Dr. Jillian Stearns. I'm one of the attendings at Carolinas Medical Center in Charlotte. And I was asked to sort of talk about the AI hidden curriculum, sort of what are the things that we look for that make an AI stand out versus one that is sort of middle of the road versus one that ends up not being ranked by our department. And so the advice that I got before my AIs, which was ever so helpful, was, well, be ever present, but don't be underfoot, which is about as clear as mud. So hopefully I can explain that a little bit better for y'all. And then also some tips on how to prepare for the clinics and the ORs. I know some of it is relatively program dependent, but hopefully to get some ideas for things that you can do, which honestly will probably continue to serve you through residency and into attendinghood. And then I was going to finish with sort of what our hidden curriculum is, or something that I think we tend to lose throughout the AI process. You can go ahead and advance. So be ever present, but ever underfoot. I think one of the big things that you can do that will help benefit you is get the residents on your side. And I think one of those is ask the residents how you can help on the first day. So during, pre-round, get the vitals. If you notice that Mr. Jones in room 323 needs to have his Fournier's dressing changed every day, go with the resident the first time to learn where the dressings are kept. And then that's something that you can go ahead and do. And it shows the team that you're proactive, you're paying attention, and you know sort of what your next steps are. And I think in a similar vein, keeping your ears open during rounds for things that you know that need to be followed up on or things that need to be done. Offer to help, call the consults, offer to help with difficult Foleys. If we know we need to reach out to another team, these are all things you can offer to do. And even if the answer is no, people are aware that you're thinking about it and you're acting like you're already part of the team. I think one of the other important things to do is if you meet with the clerkship director here we meet the first week, know what the expectations are, know what your timelines are. That applies even before the AI for when are the deadlines, when do applications open. A lot of programs will fill on a rolling fashion. So if you're in sooner after the deadline, more is the better. Also, how do you obtain letters? Different programs will do it different ways. So if you need to schedule a meeting with the chairman or the program director, it's better to do that at the beginning and know what's expected, rather than trying to scramble to throw something together in the last couple of days or do it after the rotation is over. You come across as disorganized and it ends up being more work for everybody, which is pretty much the opposite of what you want to accomplish. Ask for feedback, but not constantly. This was something that I did on my AIs that drove my residents insane. And every day I asked, what can I do to improve and how can I be better? And finally, one of my residents told me, if you ask me one more time, I won't speak to you for the rest of the rotation. So I think asking attendings, asking residents for feedback is good. Some programs will have, we have a mid-rotation check-in where that's things that we can work on for the next 2 weeks. For people who don't have home programs, while you're there, ask if there are research opportunities that you can help with. That helps deepen your relationship with a program, with the faculty, with the residents. The residents probably don't want to be doing data entry, and that's a good way to get your name on an abstract or potentially a paper. And I think the other thing that's important to know, it always feels like a trick, but if the resident or attending tells you to go home, it's okay to leave. Next slide, thanks. And sort of similarly, the residents are also going to be the one who lets you know the actual truth about the program beyond what you see on the website. So they're going to be the best ones to tell you what are the attending idiosyncrasies. There is a program in New York where one of the attendings doesn't like sniffling. If you sniffle, he will throw you out of his OR or his clinic. They can also give you ways to stand out. Are there particular things that certain attendings really like or not? They can give you ideas on how to prep for different cases. They also can warn you off or direct you towards good topics for presentations. There are going to be certain trigger topics for certain attendings. It's probably best not to pick a topic for a presentation that will send the program director into a fit of the vapors. And importantly, looking at the residents, these are the people you will spend more time with in your family. So you also get to evaluate them. Are these the type of people who are going to throw you under the bus? I hope not. Or people who are going to set you up for success and want to be examples for you moving forward. And sort of thirdly, don't forget the staff, and that's both the OR staff and the clinic staff. We have had some people who looked like bright spots, and then we got reports from the clinic staff and the OR staff that they were rude or dismissive, and it really sort of hurts our image of you. But also they can be a wealth of knowledge because, again, they also know what everybody likes and sort of what the flow is for things. Next slide. So clinic expectations, things that are helpful to ask about ahead of time. What is the dress for clinic? Some attendings will dress up for clinic, some wear scrubs, some want a white coat. It's always helpful to know ahead of time. If you don't have an answer, always err on the side of more formal towards business casual with a white coat. You can always take it off. And I think a tip that's helpful for moving forward in general is reading things like the AUA guidelines and the core curriculum ahead of a clinic, as long as you know ahead of time that you're going to be in a certain attending's clinic. I think that helps you streamline your history taking. I think that leads to having better patient encounters, and it also lets the attending know that you've read, you've prepared, and you've started to think through things. It also allows you to give ideas for what your next steps might be, which again is a way to help you shine. And most attendings, I think, will have ideas of what they want you to do. Do they just want you to take a history? Do they want you to do the physical exam and the history? Do they want you to write notes? And I think asking ahead of time, again, keeping this idea of you're trying to be proactive and you're thinking things through instead of just sort of letting me move you around and put you in a corner somewhere. And as for OR expectations, again, my hope is that you would know ahead of time or the day before what cases you're going to be doing. I think at the mere minimum, know why we're doing the case, know what the pertinent anatomy and sort of a rough idea of the steps of the case. I think for both clinic and the OR, no attending should expect that you already know everything and every detail about why we're seeing or operating on a patient. But that at least gives us a common place to back off or jump off from, and we can continue to talk. Introduce yourself to the OR staff, get your own gowns and gloves, and then help position the patient. If you know the patient's going to need to be shaved, have a roll of tape, have the razor available. Again, all things that can be pretty helpful, but seem like small things, but they're definitely noticed if that doesn't happen. So ways to prepare for the clinic in the OR. Again, the AUA core curriculum and AUA guidelines are very helpful. If you're an oncology clinic, the NCCN guidelines are helpful and in beautiful flowchart fashion. The Pocket Guide to Urology by Weeder is something that I used throughout residency. It is not the cheapest thing, but I have 2 copies that are falling apart, and I have probably more than made up for the price that I paid for both versions. YouTube videos were really helpful for me, the way that my brain works. It allowed me to pause, rewind, and sort of go through the steps of the operation. And so that way, if I got to see, for example, a robot case, it wasn't my first time looking at things, so it didn't look like a sea of yellow. Surgical atlases can also be helpful. Also, if you're going to get hands-on ability, practice your knots. That's not the time to be throwing a knot for the first time. So having the silk ties through the string of your scrub pants can be really helpful. Next slide. And then I think just touching base on the hidden curriculum. And I think this is something that students tend to lose sight of. You are evaluating us as much as we are evaluating you. And so you can end up on a rotation and realize it is not a good fit for you. That doesn't mean you should blow it up and not care or listen to anything I just talked about, because you can still get a good letter of recommendation, but it's better to know that it's not a good fit. And things to pay attention to are, look at the interactions between residents and attendings. Look at the interactions between residents. Look at the size of the program. You know, you may think you want a larger program. You may do better when it's more one-on-one focused in a smaller program. You may think you want to be in one city, you get there and realize it's not the best fit for you, but it's better to know that rather than before you match and spend the next 5 years there. And I think it's very tempting to sort of put the best foot forward, and you certainly should, but not to the point where you're fake. We want to know you and not a version of you that when you show up, suddenly this is not the same person we met, and hopefully we do the same for you. We were not the same program that you spent a month with. So those are my thoughts.
Wow, thank you so much, Dr. Stearns. Those are very, very valuable pearls of wisdom. We really appreciate you sharing your insight. We're going to move right into Dr. Hensley. We will have a short Q&A session towards the end of this half hour. So if you have questions, feel free to throw them in the chat and we'll try to get through as many as we can. Dr. Hensley?
Yeah, thanks so much for the invitation to join you. I will be brief to leave plenty of time for Q&A, but generally speaking, you know, most acting interns are asked to give some form of formal presentation to the grand rounds, you know, meeting with all of the residents and faculty, and this is your time to kind of get in front of everybody and show what you got. So next slide, and I'll provide some just quick tips and tricks. So knowing that this is looming, usually in the latter half, if not the last week of your rotation, meet with the clerkship director or the program director, or whoever is kind of in charge of your schedule and your rotation, and meet with them early. There's usually a already prescribed meeting for you to touch base with them one-on-one in the first week, but if not, ask for one, formally or informally, just to get some expectations and to specifically ask them about this presentation, and get as much detail as you can. This may be your only chance to stand up in front of all the residents and faculty in the department at once. You know, there might be faculty that are on vacation for several weeks during your rotation. You never get to operate or go to clinic with them, but they show up to your grand rounds talk. You know, there might be faculty at the VA or satellite campuses that come and tune into grand rounds and never get a chance to work with you one-on-one. So Be prepared. I said, leave no doubt. You want to do a great job and you want to leave a lasting impression because again, this is usually your last several days of your rotation. This is also your chance to kind of say thank you. You know, that's generally the format is the student stands up and says, thanks so much for the invite to be a rotator here. I really enjoyed it for this and that reason. And just be kind of grateful and humble during your presentation. Click. So in terms of topics, there may be some differing opinions of the faculty on this call on this, but I do not like recycled talks. If you do a home AI and 2 or 3 OAs, then you should do that many different talks. It exposes you to more material and makes you a content expert in that material, but it also personalizes the message and the kind of the case that you're building your presentation off of. And we often, when we write letters of recommendation, you know, Susie rotated at the University of Kentucky. She gave a great talk on hematospermia. And then Susie also went to UAB and gave a great talk on hematospermia. And then she did the same thing in her home program. And we read that in the letters, and we say, okay, she was a one trick pony. She had one good presentation. And I don't personally think that goes over as well as finding a personal talk within each one of your rotations. Talk with the fellow students, talk with the residents, make sure you don't have any overlapping topics. You usually are rotating with 2, 3, 4, 5, 6 rotators at a time. In terms of picking a topic, be the expert in the room. And by that, nobody expects you to be a subspecialty urologist. But you don't want to give disease state topics. You don't want to chew off metastatic castrate-resistant prostate cancer in a 10-minute talk because there's someone else in the room that knows a heck of a lot more than you do. And that person's not learning. That person's not going to be engaged. You also, the flip side of that is minutia. Don't pick a topic that one case report has ever been written on in the urologic literature, and nobody in that room is ever going to manage that type of patient ever again. Everybody in the room should be able to learn from your presentation. And then my personal preference is that you pick a topic based on a patient interaction or a clinical encounter during your rotation at that specific institution. So during your first week, you're in the infertility clinic and you find some really cool topic or some really interesting patient, approach the faculty in that clinic and say, hey, would this be a good topic for my grand rounds presentation? And if so, would you be willing to mentor me? And if that's the case and there's that relationship set up, send them your slides 2 or 3 days in advance and just say, hey, I put this together. Would you mind taking a look and making sure I'm on the right track? And a lot of times students want to present on these really rare cases, and that's fine if it's an appropriate topic. But that's also, as Jillian mentioned, that's an opportunity to write up a case report or help with some research projects. So next slide. I'm not going to delve into this too much, but again, you want to pick an appropriate topic, bite-size, lecture for 10 minutes. You don't want to do a big disease state. You don't want to do some nuanced minutia. I provided a couple samples in these slides that we don't have to go through if you click. Are these slides going to be sent out, Carmen?
We can, if
Okay.
you allow us to, yes.
Yeah, for sure. But these are just examples, I think, of finding the sweet spot, enough where everybody in the room can learn something during your 5, 10, 15-minute talk, but you're not having to cover a whole, Campbell's chapter, for instance. So next slide. And then I think this is the last slide, but when preparing for your talk, make the slides simple, avoid flashy animations and decorations. The slide should be summative, so you should not be reading off of the slide. Everybody can read your slide. They are reading your slide. So don't verbatim just read off of your slide. You want to contextualize. You want to show everybody, this is for the visual presentation, but based on the literature I read and this article I read, and you contextualize the clinical scenario based on your own experience and your own expertise and knowledge. Cite references. Typically in a professional presentation, you don't have a big bibliography slide at the end. I see that a lot from students. Typically in a professional presentation, you'll cite the references on the slide as you give the data. That's the more appropriate way to do that. Stay within time and leave at least a couple minutes for discussion. Nobody likes when somebody goes over. You know, for instance, we have 4 students present in an hour, each one gets 15 minutes. So if one student goes 20 minutes, they're stealing time from their peer. Anticipate questions, and if somebody asks you some ball buster question and you don't know the answer, just be truthful and go look it up and maybe get back to that person you know, the next day with hey, you know, I know you asked me about this specific drug that I didn't know about, and I looked it up and this is what I found. So I think that's it, Carmen, in terms of
Great.
slides.
That's it. I'm going to stop sharing for a minute here, and then we're going to open up the floor actually to everyone. I'm going to go ahead and pin a couple of pictures up here of our panel here, but I'm going to get started with some questions. We've got about 9 minutes of this session. And again, if anyone has questions, please feel free to add that into the chat. But we'll have joining Dr. Stearns and Dr. Hensley, also Dr. Borowski, who I may have missed, and then Dr. Penson, who I did see join us.
I'm
I see you,
here.
Dr.
I'm here.
Penson. And so thank you to everyone. Yes, please, Dr. Clark. We would love to hear from you.
I was just going to add one potential thought, which may not apply to everyone, but I personally always found it particularly engaging if you happen to have a research project that you could talk a little bit about as part of your talk. I think that always plays particularly well because it, A, is something you would be an expert in that no one else would know as much about, and B, demonstrates your research, demonstrates the work you did. So if you have that option, I think it can actually go over quite well.
I completely agree, Dr. Clark. I think not everyone gets to see all the student CVs, and some of the students have done really impactful research that I don't find out until I'm interviewing them. And so sometimes being able to kind of cleverly tie that into your presentation can be very, very effective. Thanks to the many questions that have already been pre-submitted, this actually helps me stay organized, so I appreciate that. There have been a lot of submitted questions specifically for this session. Some of the top questions that I received from you all were questions about what is something that, you know, the best interns or the best residents you've worked with have in common, and what are the characteristics that we should strive to emulate? If it's okay, actually, Dr. Penson, we'll start with you since you're unmuted.
Thanks for calling me. Look, I think the most important thing when you do these rotations, and you know, a lot of the high points were covered in the presentations. Be yourself. I mean, don't try to be something you're not, because people see through that. You know, what are the best characteristics? Well, Dr. Stearns kind of covered a lot of it. Come prepared. You know, I don't expect a medical student to have a knowledge base like a resident, certainly not, but I do expect them to know the basics of the patient's history. And I expect them to know, at least in general, what we're doing in the operating room and some of the real basic stuff. Part of my job, if I'm pimping them, they're not going to get all the questions right. It gives me an opportunity to teach, which is what I want to do. The other point I'll throw in there, you know, there are a lot of do's. Just be yourself, work hard, you know, commit yourself to the fact that, you know, this is a month of your life, and it's your number one priority for the month. And as was alluded to, you know, the programs are auditioning for you as well. But one thing you don't want to do, and you see this from time to time, is, you know, the people who sort of, you know, I don't know, the brown nosers. I don't know the better way to put it. And the people who are, you know, you know, the one sub-I who's trying to stand out above all the other medical students. People see that, it doesn't go over well, and most programs don't want someone who's not a team player. I mean, that's part of this, is to say, who's going to fit into our team? And not everyone's going to fit into, you know, the team at Vanderbilt or MCG or UAB. Each of our institutions is different. So you can't really fake it, right? But if you're, you know, if you are, you know, cutthroat with the other med students, if you're, no one should ever be cut, you know, with the residents are evaluating you as well. But just remember, you're evaluating them and they're evaluating you. Be a good person, be yourself, work hard. It's going to work out.
Dr. Borowski, do you have anything to add to that? I'm sorry, I don't mean to call you out, but
No.
let's hear from you.
I think it's great. And sorry if you hear a little bit of background noise here. I think he said it exactly right. And it's really just that whole picture. But really, I think what stands out the most for us is just someone that's prepared. You know, if If you can't do the work when you're trying to be your best, then I'm concerned about whether you're going to be able to do the work when you're at your worst. And so it's, really trying to be prepared. And so reading ahead for clinic, reading ahead for the OR, making sure that you know what you're about to do, either before you go into clinic or before you go into the OR. If you're at a place, we try to provide, like I'm sure most of us do, the schedule before the start of the block, so everyone knows where they're going. But if you're not aware, say, hey, can I, ask, where am I going to go tomorrow? Where am I going to be, so I can prepare, not in an annoying way, but just I would like to make sure I'm prepared. Can you let me know where I'm going to be? Someone showing up into the OR, into the clinic where they haven't read about the patients, that's just, that's a really big red flag.
Perfect. We may have room for maybe one more question. We get asked a lot about how to get involved, and how to connect with your program or your AI programs before you get there. Do you guys have any tips or tricks, anything that you've witnessed that have been very effective, especially for someone who really is not from this region, but wanted to know a little bit about your program or you before they get there?
Christy, you want to do that one?
Sure. I think that's where having a program coordinator is incredible. And having that person be readily available and responsive, and then sending us those messages, because it may be, again, that we can link them up with a resident, we can link them up with a faculty beforehand. So I think just really reaching out. And I would also say, we also understand that life happens, right? And so sometimes you may have a wedding, you may have an event, you may have something that you need to do during that AI time. And it's always very helpful when we're receiving that message early. Again, it shows preparation and it shows dedication. So just really communicating well and early with the program coordinator, who then can relay messages on.
Dr. Hensley, Dr. Stearns?
I think working through the program coordinator is a good idea. I also think if you happen to be presenting something in a meeting, like a section setting and things, where you can reach out ahead of time and see if there's time that you can meet with people at meetings, so that people know that you're interested. I always pay attention when people send emails before VSLO opens. If they're interested and they reach out, then it's something that I keep track of.
Yeah, same.
Yeah, I echo that sentiment. If you have genuine interest in a program before the applications open, please do reach out to them. I typically go straight into VSLO and triage those applications for students that have expressed interest. So highly encouraged.
I'm sorry, didn't mean to cut you off.
Hold on.
I would just add one other thing. I think if you can't do it before you get there, as soon as you get there, I think it's important to connect with the residents. They're going to be the ones who tell you, this is how the service really runs. This is where you go for dinner when it's, 9 o'clock at night and nothing else is open. It's, safe to drive through this part of town, maybe not this part of town. And again, yeah, you're doing an audition, but the program's auditioning for you as well. If the residents aren't welcoming and they don't want to, help you out, it may not be the right fit for you. So I think, you really have to rely on the chief residents, and the junior residents tend just to be busy as all get out. But, the more senior people, their job is to make you feel welcome and make it a good experience for you, just like it's the faculty's job the same way. So I would encourage you, if you know a resident who's there already, really take the time. And if you don't, if you call the program coordinator, ask them if there's a resident that you could connect with beforehand, just to get sort of the social tips of where to go, what to do. And if nothing else, the first day you're there, connect with one of the chiefs and go from there.
Well, that's really great advice from our panel. I'm going to be respectful of everyone's time. It's 5:29, right on time. Thank you very much to all four of you for joining. Really appreciate your advice. We're going to move on to our next session. I get to play host and unclick everybody, so apologies if this is going to take a minute. But in our next session, I'm going to share my screen. It's going to be a bit more conversational, and we are going to move right into this. All right. So the next session is going to be on ERAS applications. I know we're in the thick of going through AIs right now and getting ready to sort of get our books ready and travel across the country. but ERAS is coming. And so this is the time to start building your portfolio. What do you need to think about? How do you identify your letter writers? What are some personal statement do's and don'ts? We have a fantastic panel for this. They're all program directors. We've got Dr. Scarpato from Vanderbilt, Dr. Mehta from Emory, and of course, Dr. Cox from MUSC. And so I am going to now stop sharing my screen. And is Dr. Scarpato online? Dr. Scarpato, if you're online, please say hi. If not, I'm going to just actually go right into Dr. Mehta.
Hi, Carmen. Thank you for having me. So
Of
nice to
course.
see everyone here. So I am tasked with talking about personal statements, but if you need me to pivot, I can. I actually think the personal statement is the most important part of your application, and I may be biased, but as a program director reviewing all the applications that come my way, this is the one that I read first, or the part of the application that I read first. Um, and it's my kind of first chance to get to know the applicant. The reason why I like this is because it's your chance to tell me what you want to tell me. Everything else in your application now is templated. You know, many of the letters of recommendation are templated. A lot of the dean's letter or MSPEs are templated depending on the institution that you're coming from. But this one is very much free form, and you can emphasize the parts about you that you want to emphasize or don't want to emphasize. So it tells me a lot about the applicant. My advice to candidates when they're writing their personal statement is, one, truly make it personal. I mean, it is supposed to be personal for a reason. We want to get to know you. Everybody applying into urology is very smart, is very talented, loves urology. Do not waste space or words telling me why urology is a great field. I already know that because I'm already a urologist. I want to know how you would fit into this field and what your interest is in my program in particular. It is difficult to tailor your letter to that specific program, of course, but if there are 2 or 3 or 5, say, key programs that you are applying to, they're your very, very top few programs, consider making that personal statement personal, maybe adding a few sentences at the end, why that particular program stands out to you, why that particular area of the country stands out to you. And I think for us as program directors, that's very meaningful to have that connection with the applicants. Number 2 or 3, I guess we're on, you want to showcase your strengths that are not evident on your CV. So if you have done a lot of research, you have written a lot of papers, don't spend the time on your personal statement telling me more about that. I can get that from your CV. I know exactly what contribution you have made in that arena, but I would maybe love to know what else, excites you, what else your interests are. Perhaps what it is about surgery that you like, or working with your hands, or maybe there's a particular volunteer opportunity that gets you excited. So enhance your packet, don't repeat your CV. You think you are stressed as a candidate, but we are also stressed as program directors, because in our very, very small family of 5 to 20 or 25 residents, we are trying to find the next 3 or 4 or 5 residents that are going to fit in and really be cohesive with the group that we have. So we are very stressed in terms of finding the right applicant. And it means a lot to us when we read a letter and it reminds us of somebody we already have in our program, or somebody who shares an interest with someone in our program, or somebody who speaks to the strengths of my institution, that I can really help you along. So for example, I'm at Emory. We're a very busy program. We have a very diverse patient population. One of the reasons people love to train at Emory is to be able to work in a safety net hospital. And that's very meaningful to me when somebody writes in their personal statement about a prior experience they've had, or why they're passionate about that patient population. Then I know that that's something that I can provide to them in their training that aligns with their interests. So as program directors, we are trying to make sure that you guys also have the best experience, the right experience for you. And a personal statement can help you with that. And my last piece of general advice would be make sure that you have a trusted person or two or three read that personal statement. Somebody who knows you. It could be a mentor, it could be a family member, it could be a spouse. If you're embarrassed to show that personal statement to somebody else, then it is not ready for the light of day to be shown to a program director. So find somebody who's honest with you, who would give you feedback, who would read that and say, yes, this tells me a little bit about who you are as a person versus this is sort of generic vanilla, doesn't really tell me anything more about you as a person, and really use that advice to enhance what you're writing. Those were my top 5 or 6 things that I wrote down.
That's perfect. Thank you so much. I think sometimes just having a concise list to focus on, especially when you can write about so much in your personal statement, is just so incredibly helpful. Thank you so much for giving those top 5 tricks. Dr. Cox, if it's okay, I'm going to actually pin you on here, not to put the spotlight on you, but since Dr. Scarpato is sort of indisposed right now, I think this might be a good opportunity to just kind of open up the floor. Obviously, just like the last session, I got a lot of questions about ERAS. How do you guys sift through applications, especially for, I'm sure for both of your programs, you guys get hundreds and hundreds of applications. And so I thought maybe we can just kind of start conversational if Dr. Scarpato joins. I'm happy to, just add her in here if that's okay. And we can definitely dive into sort of this letter writer mentor situation. A top question that gets asked every year is how do you identify someone to be your letter writer? And then how do you ask? How do you approach them? Dr. Cox, can you maybe share some of your wisdom on that?
Sure. I think that there's a lot to be said for you having a personal connection with somebody, but sometimes when you're on an acting internship, that deep connection doesn't happen right away, or it doesn't happen early enough. And really understanding within the program who the letter writers are that the residents know, and this is particularly usually the junior residents, who are good targets to ask for this, the people who are really interested. It's very helpful for you to have somebody who wants to write letters and likes doing that and is interested kind of in this part of academic urology, but also somebody who's willing to sit down with you with your CV or with let's say some of your application materials from your visa application, and really look at you as a candidate and help write a letter that's going to be impactful for you. Because what we really want to get across is an intimate personal knowledge of having worked with you. And then if you can identify who that person is early enough in the rotation, you can ask, and most programs are accommodating in adjusting your schedule so you can maybe spend a little bit of extra time with them or meet with them for a little bit of extra time towards the end of the rotation when they're going to be sitting down and writing that letter for you. So having an updated CV, having all of your application materials at the ready so that if that person wants additional information to help write that letter, you can email that right to them. And then, it doesn't also hurt when you have a letter writer to kind of help them with reminders, make sure that they're kind of keeping track of you. And so as the season goes on, that's something that you can keep communicating about and keep those lines of communication open. And some of these people are going to be your mentors and the type of people that know you really well at your home institution, or if you don't have a home institution, some people that are mentoring you on your acting internships, and some people are going to be more champions of your application. And so those are going to be people who maybe you haven't spent as much time with and need a little bit more of that background information. I do see Dr. Scarpato in a hat and a mask, and so I don't know.
Hi.
Hey, Dr. Scarpato.
I'm so sorry.
No, totally
Hi, everyone.
okay. Thank you so much
Yes.
for joining. We have just started talking about, letter writers, how do you identify a mentor, sort of the process. Dr. Mehta just shared, personal statement do's and don'ts. And so we thought this would be a nice segue. Would you mind sharing a little bit of sort of what you
Not
think?
at all. Not at all. I'm so glad that Dr. Tong has put this together. What an awesome, successful event. I think it's so high yield. And you've got great speakers. So I'm glad to be included.
I think there's letter writers and there's mentors, and they're not always the same person. As Dr. Cox was just saying, sometimes you're on AIs and you don't really have the opportunity to form a mentorship relationship, because I don't know what it's like everywhere, but at Vanderbilt, we want you to have an opportunity to work with everyone. And so it's hard to spend a lot of concentrated time with anyone attending. So my advice in that situation for letter writers is ask early. If it's your intention to get a letter, nobody likes surprises and last minute requests. So, identify someone in advance that you feel like you either have connected with early on in the rotation, or potentially you've heard from the residents, this person would be good for, letter writing, spends a lot of time with medical students in general. Or maybe when you start the rotation, here it's Dr. Abby Taylor, she will kind of tell you in advance, hey, Vanderbilt writes a composite letter. And so you will spend time with the PD, the APDs, the chair, and the letter will come from them, but we solicit feedback from the residents, and here's how you do that. And we solicit feedback from other faculty, here's how you do that. And in our institution, it's a red cap kind of survey. So if you're a medical student here, you send that survey to whoever you worked with that day, and then that comes to me, and that helps with our letter writing. And I noticed that a lot of institutions now are doing composites like that. So, good to be aware in advance. What is this? If it's an AI letter, what does it look like? Do I need to ask someone, or are they going to automatically write me one? As Dr. Cox said, have your CV and have your personal statement, if that's available, at the ready, because that is something that we will refer to help us get a better understanding of you and what makes you tick and what you're all about, and potentially some of your accolades. So that's I think important too. So being prepared, identifying upfront, not waiting to the last minute. And then mentors, like, how do you find mentors? And that's hard too. I mean, I think that a lot of it can occur organically, and you just spend time with someone and you feel a connection, but it doesn't always happen that way. Do your research, who works with medical students? Does someone have a role in the medical education already? And is it someone you think has time, or is it someone you think is like really stretched thin? And so you're going to want to try and schedule appointments, but they are always traveling, or don't seem to be able to potentially build in time for a mentorship relationship. Be present, when you're on a rotation, whether it's urology or not, be engaged, be present, and like make eye contact and engage with folks there. And you'll be surprised at the relationships that form. And then mentorship is definitely like a two-way street. So you want to think and be deliberate about what you want to get out of the relationship, and go into those meetings with a plan. Like, what is it that we are going to talk about today? How can my mentor help me? What do I need to provide my mentor so that he or she can help me with whatever it is that I need? And if you need to change something, make sure in advance you're changing the appointment and not leaving someone kind of high and dry. But definitely it's a bi-directional relationship, which is one of the great things about mentorship.
Wow, very good points, Dr. Scarpato. I do really appreciate, and first of all, it's really hard to summarize how to find a mentor in a short amount of time, because there's also different types of mentors. And then I think mentors don't always make the best letter writers also. So those are really good pieces of advice. I think one of the top questions that I always get asked as a DO, coming from a school that didn't have a home program, is, as program directors, when you're looking at a set of letters, is it more impactful to get a letter from potentially a community urologist or a local urologist that you've been working with very closely for several years? Or is it better to ask for a letter from a program that you did in an AI where maybe you didn't do such a good job from, but it's a big program and everyone knows the names on that letter? How do you, as program directors, sort of evaluate and weigh those kinds of letters?
I will say here, it's definitely important to get letters from people who know you. And so if the person who knows you best and can really write you a really strong letter is out in the community, great. One of your 4 letters, because you can use 3 or 4, should be from that person, and we read them, and that's really meaningful. And I would encourage you then also to get them from your program, the academic programs that you're rotating at, so that we can get a sense for, you know, how you did on your acting internship and at your own institution. But I definitely would not shy away from getting 1 letter, my personal opinion, from someone who really knows you. I don't know if Dr. Mehta or Dr. Cox feel differently.
I would echo that 100%. I think having that letter writer that knows you very well is important to have in the mix. And if you're coming from a small program and maybe you don't have a urologist at your home program, but you worked with a general surgeon or OBGYN or somebody who can attest to, you know, your surgical skills and your work ethic, that is a good letter to include as one of your 4. We are a small field, so I think there's, you know, not to like beat around the bush, but it does help you to have some letters at least from programs that are recognizable or people that are recognizable in the field, right? But those letters could be composite letters, for example, from programs where you have rotated. It doesn't have to be that particular person, but it could be that program that evaluated you, and maybe it has the chair's name or the program director's name or both. And that gives you a little bit of face value. So I would try to mix it up if you can.
Yeah, for
Those
one
are
comment,
just really good.
Carmen,
Yes, of
Tom
course.
Chi, I'm at UAB, and
Oh, Dr. Shi, yes.
I would just synthesize a couple of those comments that I made, and the previous sessions were so great, and I mean, just the fact that this evening is happening tonight. Many folks on the call may not even realize, I mean, Dr. Mehta, Dr. Scarpato, Dr. Clark, I mean, I've all these folks who've just said words. These are some of the most well-known people in urology that you may come across in the field. And you might not know that from your position. And if you think about, okay, how do I meld those things together? I'd love to get people to know me really well and also get letters from folks who are well known in their field. Those are opportunities for you to, one, ask people in your home program. If you don't feel comfortable asking people at programs you're visiting, who are the people I should get a letter from when I go to Vanderbilt? So those are questions that are very reasonable to ask ahead of time. And then if you think about, well, how do I then meld all the things that I heard just now? How do I build that relationship and build it quickly? Getting involved in research, being present in the OR, spending time with multiple people at any program you go to visit. All those things are how you build those relationships. And so you don't have to be besties with a person to get them to write you a very strong letter. But if you put an effort in and are strategic about it too, it can help you in the long term because it's a small field and we want letters from people that know you really well, but it doesn't hurt if everybody knows them too. So I might just put those things together for you.
Thank you, Dr. Chi. That's really good advice. Great to have you on the call also. Not just saying that because you're my chair and that you have to support me through this, but thank you very much. I got a lot of questions come in about research here. I think this is something that really stresses out a lot of students now. With step 1 being gone, people think, okay, is step 2 going to be more favored? And what about research? And especially for my friends who are in schools that don't have a home program, don't have a strong research program from DO schools. How do you guys as program directors evaluate that? We know research is important, but are you guys specifically looking at number of number of publications? Is it the type of research? Is it the quality of research? And then what about those kinds of research that just never really got published, but they presented? And so can you guys share a little bit of your thought on how research is weighed in your mind as program directors?
I can start. I think there's the value of research in my mind is that someone has made the effort to do a thing, and then they put time into learning a thing to do the thing, and then they saw it to completion and delivered some sort of deliverable at the end, right? It doesn't have to be research in urology. It could be research in some other field. And if research is not your thing, but say you were active in something else, public policy, some kind of quality improvement thing. Those are all equivalent things that you committed time to, learned something from, and then potentially delivered an actionable like item at the end. To me, those are equivalent. So you don't have to do research for the sake of research. Do it because it's meaningful to you. Do it because it helps you make connections, find mentorship. And for many students, research is a currency that's translatable, transferable, because you may not have these other opportunities to come by quite as easily. Research is actually easier to come by, I think, particularly in the post-COVID era, where you can reach out to folks at other institutions to get involved in projects. I think if you are going to do research and you're going to put that you have done some meaningful research on your CV, on your application, also be prepared to talk about it. When we see a lot of research projects started, but nothing on the publications or presentations side to show the end product, that is a red flag for us as program directors. And when we see publications and ask applicants about it and they're not able to explain to us exactly what they did, that is a definite red flag. So if you are going to put it on there, make sure that it is meaningful, that you understand it, and that you can explain it.
Totally agree with that. I think research for the sake of research is not going to help you that much, but if it's something that you're passionate about, that's great. And we're going to want to ask you about it and we're going to want to hear about it. And then also what Dr. Mehta said is really important. If you're going to participate in research, make sure that you deliver, like you do what you say you're going to do. You've learned, the research process, and you can talk about it in an educated fashion. I understand research is not for everyone, but if you are going to commit yourself to research, try and find something that you really care about and that you will be able to write abstracts, present papers, like talk about in a way that is showing how meaningful it was for you and that you learned something from the process. But really, I think we're looking at the whole picture. Research is just one part of that picture. And if you can demonstrate your interest in surgery and your commitment to leadership, and you've dabbled in research, that's great. If you're someone who's super passionate about research but have the other parts of your application demonstrated in some way too, then great, you might shine in research. It's just one way that you can demonstrate you're interested in the many aspects of urology, research being one of them.
That's great. We have a few comments on the side I would just like to highlight in case anyone's on their phone and can't see them. Dr. Mehta said, for letters, I usually ask my students if there are things they want me to emphasize. So if someone offers to do that, take them up on it. I think that's a fantastic idea. I learned from Dr. Tanaka, one of my mentors, she always has a very thoughtful sit down with any of the students that ask for a letter and ask them specifically, is there anything that that they would want her to highlight in the letter. And she always writes a fantastic letter. And so I think that's a great idea for students to come to us with things that they would like us to highlight. Dr. Terrace says, thoughts on personal statements. Remember, the readers are busy urologists, so it doesn't have to be super long. Over a page may not get read. And having a great opening sentence is a great way to catch our attention. I think that's brilliant. Yes. Kind of more concise is not always bad. Actually, some of the best personal statements I read were just half a page or 3/4 page, very impactful. And just like Dr. Mehta said, you do not need to rehash, I think, things on why you love urology and what about urology excites you. I think that's important, but we get it. We're urologists. We love our field. We want to know about you. Dr. Clark says, if you do not have a home program, then when you go on your acting internships, ask the folks at those programs the sorts of questions you are hearing here. All of us understand the challenge you face, so we're generally very happy to help. The AI is the opportunity for you to learn about your strategy. Brilliant. And then Dr. Terrace comes back with more advice. Thoughts on letters of rec. If you have a special long-term mentor relationship with someone who is not in academics, I agree that one letter is okay. Our bias, however, is If it is someone we don't know, if they say you're the best student you have ever seen, you're the only student they probably have ever seen. And so academic senior urologists are still probably going to be your best bet. I completely agree. I think that's the fine balance that you program directors have to sort of weigh, right? How much do you trust someone who's out in the community, who probably have plenty of clinical experience, great patient bedside manner, but may not have a ton of experience working with students. And the landscape of training now has evolved significantly since 10, even 5 years ago. And so I think, balancing having those community letters with having letters from AIs are going to be super important. Thank you for those thoughts. We have 5 minutes left.
Can I add one more comment?
Oh, yes, of course, Dr. Scarpato, please.
Okay, great. And this kind of gets at all the things research mentor and writing letters. One thing that I've seen quite a bit recently is students who have reached out to urologists at other programs, not that they're rotating at, but they saw someone at a meeting or they read a paper, or they've interacted in some way from afar and said, hey, will you mentor me? And the one that's coming to mind right now is Kirsten Green. I know some students have reached out to her, and she's had like virtual meetings with them and mentored them from afar, and in that relationship has been able to write letters. So if you don't have a home program, or even if you do and you're interested in connecting with someone nationally, feel free to reach out. A lot of times we'll say, yeah, that's great. And let's, in this digital age, it's easier to connect on Zoom or Teams. And that's just another way to get to learn about urology, make some connections, and maybe get another letter.
Completely agree. I've had random students reach out to me from meetings or from other student-related groups. I see you, Irene, you cold emailed me, not to call you out, but there have been plenty of students who have cold emailed all of us, and I actually really do enjoy those special moments. We have a participant question here. Yay, finally. We've got a student doctor named Arjun who asks, I was told that it can be useful to ask a letter writer that knows you really well to talk about how you have overcome a red flag or weakness that may appear on your application in your past. Do you agree? Fantastic question, because we have people who may have not matched the first time, took a gap year for personal reasons. Do you think a letter writer should talk about that? How do you think a student should even address that kind of topic?
I can take that. We have a pretty strong prelim surgery program, and have a lot of reapplicants come out of our program. So I've written a lot of letters for people who reapply, and I think, on the receiving end and in helping these people match at other programs in the last few years, I think it's really helpful to have your letter writer know exactly what went on, whatever this issue or red flag is or weakness in your application, why you think you didn't match, what you've done since then, and actually explaining that on the face of it is very helpful, so that that person who's reading your application doesn't get to the very end of your application and say, oh, wait, this was last year's dean's letter. Is this person a reapplicant? And so having that just out in black and white, I think, is really helpful.
Can I add one point to that? I think if there is an opportunity to take something that perhaps was a problem, say you had an adverse event in your family or something happened such that you had an issue, you can actually turn it into a strength in a way if you can create a narrative around how you overcame whatever that is, how you came out stronger on the back end of whatever that might have been. It's a way to take something that on the face of it could be interpreted as a red flag and actually turn it into a positive and a strength if you can, if that's feasible and if it fits the situation. So where possible, I think, echoing what Lindsay's saying and then taking it another level even beyond that, if that is reasonable and makes sense.
And Dr. Stearns left a very powerful message here. She said, as someone who did not match the first time, but is now an academic urologist, I made that my personal statement, which addressed it and also discussed what I had learned and how I had changed. Fantastic advice. I always do encourage students to sort of address the red flags head on. Don't hide it, because that actually makes it more suspicious, in my opinion. And that can serve as a great talking point for your interviews. And oftentimes we've actually invited students because of whatever they had gone through, and they had addressed it in a very meaningful way. Well, it is 6 o'clock. We're going to move on to our last session, trying to be very respectful of everyone's time. Thank you so much, Dr. Mehta, Dr. Cox, and Dr. Scarpato, who look like you just came from the OR. Really, really appreciate you finding the time to speak with our students here. And of course, anybody who has additional questions, continue to field them in the chat box. I'll do my best to monitor that. And there's also a link on there. We're asking for some post-webinar surveys from you to let us know how we did, how I did, and how we can make it better next year. Okay, so we're going to move on to the last session. I'm going to go ahead and unpin everyone so you don't have the spotlight on you anymore. Okay, so I'm going to share my screen one more time. I do have some slides to share with everyone. All right, in this last session, we're going to talk about interviews. Aha, so you have gone through your AIs, you have submitted your ERAS applications, and you've gotten some interviews. Let's talk about preference signaling. I've gotten a lot of questions about this, and I think this is a great time to sort of address the elephant in the room. How do they work? Do's and don'ts. How should you pick which program to preference signal? And then also how to prep for interviews. For this very last session, we've got some dynamite panelists. We've got Dr. Peter Clark from Atrium Health Carolinas Medical Center, Dr. Chi from UAB, and Dr. Martha Terrace from Medical College of Georgia. And I'm going to make this bigger. So I put together these slides because I also wanted to learn myself. And so please bear with me. This is going to be on interviews and preference signaling. Many, many thanks to my incredible trainee team here at Children's who helped me put some of these slides together. Kartik Patel, who's a fourth-year student, rotating through and going through his AI soon. And then Caroline Wade, who's my second-year fantastic resident, who also chimed in to make sure that the content is appropriate. So preference signaling, what are they? So this is something that's new that came out a few years ago. We basically emulated a couple of other specialties and decided how can we help students figure out how many programs to apply and to really show which programs they really want to go to. So this is from the SAU website. And if you're not sure what preference signaling is, I recommend you going to the SAU website. That is the Society of Academic Urologists. They are the people who govern how match works for urology and basically decide, how match goes every year. So preference signaling, you get 30 equal weighted signals. This is an optional process. It is done through the AUA Match platform. This is important. It is separate from the ERAS platform, okay? And these signals go directly to programs. So only the programs that you signal saw that you signaled them. Why is this important? Why is signaling so good and so preferable now based on all of the surveys that have come out sent out to the students? Well, that's because traditionally, students would apply to 80, 90 programs, as many as they can. And this has made match very stressful, expensive, and inequitable. And there was always no really good formal method of showing that you're truly interested in that program. You can send emails, you can get letters, and there's some geography, but they're all noisy and biased. And so really preference signaling offers a formal, credible, and equitable way to express interest. Again, these came from SAU website, okay? So let's talk about the schedule. Many of you have asked, okay, what is the schedule? I'm really confused. AUAnet.org. That's going to be your best friend for the next couple months, okay? This is directly from the website. I have the website down at the bottom here. So you can see that, hey, on June 24th, registration opens for programs and applicants. September 3rd is when signaling opens, and September 16th is when the signaling deadline is. Okay, so it's very important you remember that date. You do not want to miss that date. I heard a horror story that someone missed the date to submit those signals, and then that person had to email all the programs and ask for forgiveness. It's just not a good look. So it's a separate process through the AUA, not through ERAS. So just please put that on your calendar, okay? On September 24th, those signals get sent to the programs. And then October is when we start offering interviews to applicants, all right? And then the rest is basically everything you've heard. You start getting interview offers, and then you go on interviews, and then you submit your preference list, and then you find out your match. This is actually updated for 2025-2026 on auanet.org, okay? So best practices, how do you use these signals? Again, this is also from SAU website, okay? Use them strategically. You really want to only signal programs that you want to go to or at least want an interview from. Per the SAU website, you should signal home and away rotation programs, okay? Talk to your mentors, talk to your letter writers, figure out which one's your best fit. Just because a program's competitive or a quote top tier program, it may not be what you want. Maybe you want a research year. Maybe you don't want a research year. Maybe you want a program that has a safety net hospital like Emory. Those are things that your mentor is going to be able to help you. Just remember that just because you signaled a program, it does not guarantee an interview. And if you didn't signal a program, it doesn't necessarily mean that you won't get an interview at that program. How each program manages signaling is very dependent on that program. Now, important that I go through this, the program code of conduct, okay? Meaning on the program side, we can't really ask you, okay, at all. Okay, if you had signaled before, where you've signaled, how many signaled, how many signals you've sent, those are illegal questions. And if you get asked them, you can just politely smile and say you haven't figured it out or diplomatically kind of divert that question, okay? Programs aren't also really allowed to use it as a filter to ignore applications that were non-signaled, okay? You're required, meaning us, the programs, are required to look through all of the applications, okay? Do's and don'ts of preference signaling, okay? Please do consider using all 30. You know, that's your tool to express interest. There's really no reason to shortchange yourself. Remember to signal your home and away programs, okay? You can target programs where you haven't rotated. You can kind of mix and match. Again, talk to your mentors. Think about geography, the culture of the program. Talk to your mentors about what those programs are like and your personal priorities, okay? And please do not forget to submit within the AUA window, okay? Don't only submit to the top tier programs. Don't forget to submit and signal to your home and away program unless they were specifically telling you not to. Do not signal programs unless you are seriously considering attending that program. Again, you only get 30, so use them wisely. Okay, and don't try to game the system. All right, programs can only see who signaled them, not everywhere else you applied. All right, so we're going to switch gears. We're going to talk a little bit about interviews. And now you've signaled everything. Now you're getting ready for your interviews. We're going to talk about do's and don'ts, how to prep, and really what program directors and chairs are looking for. Okay, so we all know that there are selection factors that every residency program considers. Those include your clinical grades, the reputation of your medical school. Some programs do care about that. Your research output, we talked a little bit about that. Letters of recommendation, where you rotated your aways and where your letters are from. Your scores, now that step 1 is pass fail. Some programs are looking more at step 2 programs, step 2 scores, excuse me. And then of course your interview performance, all right? This is a paper that came out from urology practice, I believe earlier this year, 2025, maybe 2024, from Kathleen Kobashi and colleagues. Okay, and this is program directors selection criteria. Okay, in the era where step 1 is now pass fail. We get asked this all the time, like, okay, we don't have that objective data now. How do you decide who you're going to interview? Well, I can tell you, I've attended several SAU meetings now, and this comes up every year, all right? And so this was a survey that was sent out to all the programs. About 60 responded, and these are the top ones, okay? The ones who signal, the ones who did a sub-I at that program, all right? Letter of recommendation, professionalism. If the interviews are held virtually, that means dressing appropriately for a professional business interview, right? Having appropriate background, having your camera on. So we'll talk a little bit about interview etiquette. Prepping for interviews, okay? Programs are looking for your personality, your professionalism, your interpersonal skills, and your commitment to urology. A lot of these we already kind of touched upon in the past sessions, okay? Expect that some will do one-on-one interviews, some may do panel interviews, and for those who are doing in-person interviews, there probably is going to be a social event the night before the interview, okay? And not to freak you all out, but you are being judged every step of the way, every minute that you're hanging out with the residents or the faculty or the staff, okay? Be prepared with 2 or 3 meaningful experiences that highlight your resilience, your leadership, teamwork, things that matter to you that you want to talk about. Your answers should be polished, okay? You should have a to-go answer for why urology, what excites you about urology, the common questions, okay? And then very importantly, you should always have questions ready to ask at the end of your time with your interviewer. So common interview questions that you get, and I will say this varies program by program, but usually you'll hear either from the residents or the staff or the faculty things like, tell me about yourself, why this program, tell me about a time that you faced adversity, how do you manage stress, or how do you even deal with time management, what are your career goals, talk about a personal experience with a patient, and some of your weaknesses. So you should have these answers ready to go. But on the flip side, just as the program is interviewing you, don't forget that you are also interviewing the program and making sure that it's the right fit for you. So you should always ask, I think, some of these questions, and that is, how are residents supported? How is feedback given? What kind of feedback style is used? What are the strengths and weaknesses of the program? And what changes has the program made in response to resident feedback? Culture changes. What programs are in place for blank, advocacy, research, bench research? These are all great questions, and you can tailor that to your own personal interests. Now, this is very important, and we will probably talk a little bit about this during our panel discussion, and that's illegal questions. Yes, there are questions that you are not allowed to be asked, and we need to talk about how are you going to diplomatically pivot away from these questions. And these are questions really related to your own personal life, such as, are you planning to have children? What is your religion? Are you married? What is your political affiliation? They're not allowed to ask that. If you decide to share that because you want to share that, great, but they're not allowed to factor that into rank or into, sort of the whole application. And so we'll talk about tactics on how to avoid those illegal questions. So really, how should you prepare these interviews? Okay, do mock interviews. Tap into your mentors and your letter writers or people at your school. Many schools will run mock interviews to prepare you for your season. So make sure you do those. Review your application. We've already talked about that. Know every single detail backwards and forwards because we will ask you about that. Make sure that you know what's on your personal statement and be sure to sort of share and explain any gaps, weak spots, or red flags, and just be yourself. Share your enthusiasm for the field, for the program, and just learn about the program. All right, and that concludes these slides. What I'm going to do is stop sharing, and then we're going to open up the floor for some panel discussions. And, okay. We've got Dr. Clark, we've got Dr. Chi. Oh, and again, thank you to the participants for sharing these questions to me ahead of time. That way I can kind of get the conversation going. And so I'm going to just kind of kick off, the conversation. All right. We got a lot of questions in terms of sort of how your program tries to approach in a very holistic way. I think that's like a big buzzer word now. Holistic approach, looking at the applicant in a very global way, overall way. Can you share a little bit about what your program does to make that happen? And to remind everyone, Dr. Chi is from UAB, Dr. Clark is from Atrium Health Carolinas Medical Center, and Dr. Terrace is from Medical College of Georgia. Dr. Chi, you're first on my screen, so I'm going to have you start if that's all right.
Yeah, they put the best hair up front. If you haven't noticed that on Zoom, that's just how it works. It's the technology, can't help it. So I think that holistic comment is important. Probably the biggest thing that we do is we get a diversity of opinions. And so somebody had earlier commented around, I think it was Dr. Scarpato has said at Vanderbilt, there's a lot of people in the room and there's a lot of people at the faculty. So it's hard to spend like a billion days with each of them, especially if you're rotating a sub-I. But when people come down to making decisions like that, the easiest way to get yourself kind of a very even global look by many people is by meeting many people. And so one of the things that can hurt people during that decision-making process is you'll go around the room and then one of the death knells is, I never met that person.
You remember who that
Some of
person?
it, Yes, I don't remember. You should be memorable and you should meet them both. So it's a little bit of both. Some of it's out of your control in that you'll be assigned to certain times and rotations during your time at a visiting away rotation. But you should make an effort. So if you notice that, I there was this particular person that seemed very interesting to me, but I don't have them on my OR schedule and it's my last week of rotation, try to make an effort, work with your team to make those moments happen. So that's probably the thing that we do a lot of to try to get that well-rounded view of people, that 360 view.
Dr. Clark, Dr. Terrace, any
Yeah, I mean, I guess I'll preface this by saying that there are as many different ways to do this as there are programs. All programs have their own personalities, they have their own approaches, they will prioritize and look at things a little bit differently. That's actually one of the advantages you all have, right? Because there's as many different people applying for urology as anything else. So there are places you're likely to fit, and some other places where you're not going to fit, and that's okay. The holistic approach as a consequence is a little bit different for every program, right? But most programs have some broad general sense of what they want to see on, used to be USA Only Part 1, now everybody wants to see Part 2. People get very stressed out about like, oh my God, I have to have like a 270 or I'm never getting urology. Probably not true. You just need to do reasonably well and kind of get past the bar. And then most of us don't pay much attention to that after that. So just do reasonably well, then don't worry about it after that. Personal statement, again, we've been through that in a lot of depth. I will offer my own quick thought, which is that 60% of them don't do anything one way or the other. They're very vanilla. All they do is tell me about why you love urology. Okay, got it, check. 20 to 30% actually add value because you tell me who you are and something important about you or something that drives you or something that's important to you. That actually adds value. That one I pay attention to. And about 5% hurt you because they're weird. So just try not to be weird. So if you can avoid being weird and you can tell me something that actually matters and tells me a little bit about yourself, that will help. People get very hung up on research. We do look at it. Most of us want to see some element of research, but I think I would contextualize it more about we want to see somebody who wants to make a difference in some way, shape, or form. Most of us want to see that you're doing something interesting, important, and adding value, and that whatever it is that you decide that is, that you're finishing it. Research is one easy way to do that, right? Because the currency is publications, but it could be leadership within your school, it could be leadership within your community, it could be some service organization that you've become a part of that's important. There are other ways to demonstrate that general quality, but that's usually what we're looking for. It just tends to get expressed as research more than anything else. And then there's the letters, which we've already touched on. And a lot of us, in the absence of quantitative data, rely pretty heavily on those letters, to be honest. So that's to answer the holistic approach. You are hitting all those elements, right? And the weight you put on them is going to vary from school to school, and even from person to person, honestly, within the school. But that's how I would contextualize it, sort of broadly.
Dr. Terrace left a little message here. Dr. Clark's "Don't be weird" applies to interviews as well. We all love a somewhat quirky resident, but not someone so odd that they are going to scare our patients. And I think that's such a great, crucial point. What we're doing is we're trying to train the future of urology. We want to train good urologists who are going to take excellent care of our patients. We're not looking for outside the box too much to the point that it scares our patients away, right? It's good to have personality, but just remember you do have to be relatable. So fantastic advice there, Dr. Terrace. Really appreciate that. We got a bunch of questions about virtual interviews, live interviews. And I think it's another source of stress for our students trying to figure out, should I only go to the programs that are virtual so I can maximize, and just attend as many as possible? Are the in-person interviews going to weigh more because they can really see who I am? First, I'd like to ask, at your programs, are you guys doing in-person interviews, or are you doing a hybrid or purely virtual? And what do you think about this whole environment? Dr. Terrace, I'll have you start if that's all right.
Yeah, I'll address that. Yeah, we have been full virtual since COVID, but we're changing to in-person this year. I think, we didn't match well, and people that we didn't, we matched great. Don't mean to say it that way. We love our people we have coming in as interns, but most of them are people the last couple of years that did sub-Is with us that we know in person, not people we met on the virtual interview. So I think we do feel more attached to those individuals, and they like us better. They know what they're getting into. They know our personalities, warts and all, and so those work better. So we're going full live this year. I don't know how many programs are going to stay with the hybrid, where you have the option of either virtual or in-person interviews. Take the in-person when you can, would be my advice. I think the programs, number one, it takes more effort, and that shows. And number two, you get to know the program better. It's better for you to see what you're getting yourself into. Maybe you love them, maybe you hate them. Maybe you get off the airplane in the city and already you hate it and your decision is made. There's a lot of things you can get from showing up. And so go to the in-person interviews when you can, I guess, is the bottom line. As far as signaling, I did want to talk about that a little bit more. It's very important to spread out your signals. Everybody's going to signal Emory and Vanderbilt, right? So you're just going to be one of many there. Not that you shouldn't signal them. They're fabulous programs, but you also need mid-tier, lower-tier programs, and get your mentors to talk to you about what those programs are relative to your personal step 2 score and research experience and work ethic and that sort of thing, because you may want to have all mid-lower tier programs if your step 2's a little soft, versus you can have really competitive program heavy if you've got some great research and a great step 2. So meet with your mentors several times about your signals, because it's the people that don't match are the people that didn't signal well. I'll tell you, we didn't interview anybody that didn't signal us. All right, and that's how most programs are. You have some of the newer programs, some of the small programs may not get a full complement of signals. So those may be your hidden gems to be sure you signal some of the smaller, newer programs just to have some safety options. But I wouldn't count on a lot of interviews coming from non-signaled places.
Yeah, I totally agree, Martha. And I talk about it as diversifying your portfolio, right? And you might shift a little bit more towards, like, to your point, you might shift it more towards the higher end programs if you have a certain kind of application, and maybe more on the other way if maybe it's not as strong. But don't make the mistake of assuming you're a superstar and only applying to high-end programs. I've literally known people who've done that strategy and turned out they weren't as much of a superstar as they thought, and they didn't match. And they had an outstanding application. So just be mindful.
Yeah, don't let your ego lead you.
Exactly. Listen to your mentors. Be a little bit humble about it. I'm not saying you shouldn't, reach. You should, but don't overreach and not spread things out a bit, or you run the risk of running into a problem. And to address your point, about the virtual versus in person, we had the exact same experience. We were virtual all up into this year. Now we're going in person, and it's not that we didn't get great people, but in the end, you just tended to gravitate towards the folk you knew. And it was just really hard not to get away from that personal connection you get when you meet people. And so we ended up taking, it just kind of ended up, we tended to get people who rotated with us or who we knew in some other way, shape, or form. And that we did get folk who applied virtually, but just not as much. And so I think in the end, I think a lot of places are switching. I could be wrong, but anyway.
Great advice. I think choosing carefully where you signal is just such an
Totally
art,
key.
completely an art. And you should absolutely rely on people who have been in the game, if you will, and kind of know what's going to be your strong suit and what's top tier for your buddy next to you might not be top tier for you. I think that's a term that gets thrown around a lot, but and honestly, it's a term that really should be best fit. Right. And so we've got some great questions that are coming in through the chat. We've got quite a few attendees on the call here who are reapplicants, and they have just a lot of questions about how do you guys evaluate reapplicants and how should reapplicants kind of play this signaling game a little differently? Should they just play all quote safeties? How would you kind of advise these students?
Personally, I think that, I mean, the advice I have ties a little bit to people, whether or not you're applicants or reapplicants, but I think reapplicants need to think about this very carefully and strategically too. I think that this is a time where you have to be brutally honest with yourself. So you kind of heard about the components of the application. So you have the interview, you have the numbers, you have the research component, you have the letters of recommendation, the personal statement. You have to be brutally honest with yourself on what are your strengths. So if you know that you shine in one space, and you're talking about like virtual and in-person things too, you have to really be honest with yourself of where you can shine the highest. So I'll tell you my story. I mean, when I applied, I scored back then, we still had numbers. I scored a 226 on my step one, and I had half of my mentors tell me, don't even bother applying urology. You should probably do family medicine or psychiatry. They're great fields. You have a lovely family and your life will be great. And I just know that my superpower is that I can outwork anybody to death. And so I wrote 16 papers as a third-year medical student, and I met with all the most famous people I could find, and I asked those questions, and I got those big letters. And so I didn't get an interview at many places that looked at those numbers very carefully, and that mattered to them. That was okay. I turned out okay. So, but I was brutally honest with myself. I just knew my numbers were not going to carry me. And so I compensated by leaning into my strengths. So I tell people, if you're thinking about, do I do an in-person? Do I do a visiting sub-I? Do an in-person video? Be brutally honest with yourself. Do you show better on paper or do you show better in person? And so those can help you with your decision-making around what does it mean to be a top tier or a lower tier program for you personally? And also, do I do things virtually? Do I not do things virtually? And where do I shore myself up in my application process? So hopefully that answer ties a little bit in the question that was asked about, if you're a reapplicant, how do you think about things? I think honesty is really important for yourself.
Yeah, the reapplicant is probably one of the hardest things to have to work through with someone. If you don't match, now what? Yeah, and I don't know if anyone on the call here is a reapplicant or not, but and I don't know if you want to focus on that, Carmen, or if that's not the most appropriate use of time today. But it's a whole separate strategy session, right?
Completely agree.
It's a
Completely
tough
agree.
one,
I think the conversation about, sort of where you apply, how do you use your 30 signals? And, do you apply more than your 30 signals if everyone only looks at signals and sub-Is? I mean, this can be a whole other hour. And certainly with only 1 minute left, I again want to be respectful of everyone's time, but certainly I think this is a great just little overview for everyone to kind of appreciate that, hey, on our end, it is an incredibly challenging process. We did not make the decision lightly to offer an interview to the applicants. It's a very thoughtful, careful process that every program makes every year right around this time until December when we can all take a deep breath during match time. And so with that happy note, we're gonna go ahead and conclude because we have 1 minute left. I would like to thank all of the wonderful speakers that have joined our call. I'm gonna take 1 second and see if I can pin everybody on here. Apologies, I know I like to pin things, but I do really appreciate everyone kind of taking the time to share their insights. It's evening, late for many, many of you. And did I miss Dr. Mehta? Dr. Mehta came off. I think I got everybody. So sorry if I missed you, but thank you so much to our wonderful panelists. If you like this event, if you want another one of these next year, please send us your thoughts. We would love to host more and more programs, particularly in the Southeast region. We're a very, very great AUA region with incredible programs. So thank you very much to everyone and have a pleasant evening. Take care now. Bye-bye.